think I must congratulate Shailaja for taking this initiative because it's very rare that somebody takes so much interest for the betterment of the community. Doing something for yourself is different, and doing and sharing it with people is something different. So yeah, you deserve a good applause, and
Thank you.
and I'm happy to share whatever have acquired over a period of time as a gynecologist and then as a menopause consultant. So, for my short introduction, I passed my MD in 95, so it is more than 30 years now. And I was in a routine gynec practice for initial 25 years, then COVID happened. uh, I was doing my menopause work, but it was on a back burner because obstetric work takes up all your time and everything. So post COVID, I gave up the routine gynec practice and I decided to take up only menopause. And then I was doing hypnotherapy, but I acquired a degree very recently because I wanted to take it full fledged. That's why. So, my basic thing of interest is I address menopause in a holistic way. See, there is lot of chatter going on about HRT, about different aspects of menopause. Everybody is trying to bring about awareness regarding menopause, and it's a very good thing. But we should just understand that menopause uh, it is a physiology. It is not a pathology, right? So that
Right.
is a very important thing. Just as a period starts at the age of, say, 10 to 14 years, similarly, it stops in your 40s. So it is a physiological phase. Pregnancy happens in between. Even that is physiology. So rather than addressing menopause as something very dangerous or like a disease or cancer or something like that, if we take menopause as a physiological change, as a natural happening in our life, then things become very easy. So that is what I
That's
always like to stress. Yeah.
that's a good
So
point. That's a good point.
yeah, so that is very important that this is a natural thing. It is going to happen to everybody. It's not that I become sick and somebody else doesn't become sick. Menopause, yes, it is going to happen in each and every woman's life. So there
Yes,
is
yes.
no going back from that. And so the best thing is accepting it with grace, understanding what happens, and get over it. That it's very simple. So that is the basic thing which we need to understand. And that is why holistic health, because we are not only treating the symptoms of menopause, we are treating ourselves as a whole being. And the whole being includes the body, mind, and soul, because we know that treating the body alone is not taking us anywhere. Treating the mind alone is not taking us anywhere. And soul, of course, as Indians, as Hindus, we give a lot of importance to the upliftment of our soul because all our practices are ultimately directed towards that. So now, why this is taking so much of our time these days, menopause? Because our lifestyle has drastically changed. You must have heard from your mother-in-law or your elderly women in the family કે અમને તો કાંઈ નહોતું થતું આવું. આ બધું
હા,
તમારું
બરાબર.
છે. It is very
Right.
common કે આવું તો કંઈ થાય જ નહીં, આવું હોય જ નહીં. એ તો બધું નોર્મલ
હા.
છે, કશું ના થાય. આ બધું અત્યારે તમારું બધું નવું છે. Yeah, it is true. It is new, but it is because our lifestyle has changed. Whatever work they used to do, the type of work that has changed. Our thinking has changed, level of education has changed, our environment has changed, and so the symptoms of menopause are manifesting in a different way. And so we need to address them in that way. So what is menopause? A very simple definition is when you don't get your period for one full year. or 12 months, we label it as menopause. And the area around it is perimenopause, that is 5-7 years before that and 5-7 years after that. So maybe 10 years of your life is perimenopause, something around it. And most of the symptoms of menopause are seen in these 5-7 years before menopause. Actual menopause happens. So, what are our goals to treat menopause is lifestyle modification that is sustainable. Shailaja was asking me ki, weight gain is the biggest issue. Yeah, weight gain happens in menopause, but then we need to take measures which are going to remain for the next 25, 30, 35 years that we are going to survive after menopause. So it's not that I want to sail through this phase of menopause. I want to take up lifestyle changes which I'm going to continue for next 30 years or till I exist on this earth. Similarly, the
Mm.
awareness and alertness about the symptoms in the body and mind. You know, we keep on telling ki am thai che, am thai che, am thai che. But then we are not aware. Joint pains, we keep on changing doctors. We go to the orthopedician, we go to the physician, we go to the physiotherapist. But the joint pain doesn't go because it is because of menopause. It is not because it is because of the hormonal changes. It is not because of your slip disc, or it is not because of the joint problems. So,
Um,
awareness about the symptoms is very important. Why this is happening, how this is happening, and then we will be able to tackle it properly. And taking charge of the symptoms, that is very important because, see, hot flashes we know is the commonest symptom, right? And women get
mm.
up in the middle of the night, કે ગભરામણ થાય છે, પરસેવો
હા,
પરસેવો થાય છે. So,
right.
if you're not aware that this can be because of menopause, you feel કે મને હાર્ટ અટેક આવી રહ્યો છે, કે મારું બીપી
હા,
વધી ગયું છે. Yeah, so in the middle of the night, you rush to the ER, કે મને hypertension થયું, મને બીપી થયું, and that anxiety and that overwhelmingness that
હા,
leads to real hypertension. So, to
હા.
avoid the pathological consequences, we need to tackle these symptoms in a physiological way.
Oh,
So we
very
need to
nice.
address the anxiety and everything કે ઓકે આ થાય છે, કેમ થાય છે, આ થઈ રહ્યું છે મને, it is happening. Okay, it is because of this and I need not worry about it. So that is why understanding of menopause is very important. We are not going into menopause in numbers. It is a very big number. We know, we know that with the rising age, the number of women in menopause are going to increase. So now a quick recap of what happens to the physical body. You know about the symptoms. So the it is said that there are about more than 100 symptoms that can happen. So menopause can affect from the toenails to your hair. If we start from that, there is thinning of hair, there is hair fall, there is dryness of hair, there is dryness of skin, dryness of eyes. All the mucosa dries up because of estrogen deficiency. So there is
Wow.
difficulty sometimes in swallowing, the skin becomes dry and scaly, the vagina becomes dry, even the internal mucosa. So there is constipation, there is difficulty in digestion, that leads to bloating, that leads to gas formation. So all these things are a chain reaction. The basic cause is estrogen deficiency, right? So
Right.
and then there is slowing of metabolism, which causes weight gain. That is one of the other commonest symptom that happens. Of course, irregular menstruation is there, so that we are not considering because that is a part of
Part of.
menopause. Most of the women get delayed periods and then it stops, but sometimes there are heavy periods and they need to be investigated and tackled in a different way. I'm not going into detail at present.
Right.
And then there are other symptoms, like there are certain deficiencies like B12 deficiency, hypothyroidism starts because it is all a chain reaction. There is decreased estrogen, there is negative feedback in the pituitary, the thyroid secreting hormone which is secreted from there goes up, and that is why hypothyroidism occurs. So the all even that is a chain reaction that is happening. Then there is aches and pains, like which was not there. We get multiple joint pains, fatigue, tiredness, all those things are there. Like we are usually used to getting up in the morning and we start running around, but then there will be days during perimenopause when you just don't feel like getting up. Okay, I don't want to get up. I just want to lie down. Or after say working for 2 hours in the morning, you feel कि अभी now I'll have to lie down for half an hour. I can't go about the day. So this is a very common occurrence, and it is not that you are having any disease. This is a part of menopause. So we need to go for basic investigations. Of course, in the Western part, like in your countries, it is good that you go for early thing. But for in our scenario, in Indian scenario, I like to stress that every year you should go for investigations, get yourself checked completely, get a physical examination, get a pelvic ultrasound, try to find out if there are any pathological changes that are going on, and then
Mm.
you go about the physiological changes. So
Mm-hmm.
in physiological, the physical body thing, we concentrate on the diet. Again, in diet, we focus on the weight management, the nutrition management, tackling the deficiencies, and consumption of phytoestrogens like the soy product, the tofu, and all those things which have estrogen-like compound in them. It helps in increasing the estrogen in a natural way. Then there is exercise, which forms a very important part of our life, and the exercise will be focused on mobility, flexibility, core strength, and a feel good factor. So you need to amalgamate aerobic exercise, yoga, meditation. So flexibility will come from yoga. Mobility will again come from that. For core strength, you need to do some weight training exercises. And if nothing is possible, simple walking will also suffice. But we need to move during perimenopause. That is very important. In the nutritional hacking, we have to take all the medications which we require. Like if we go into hypothyroidism, if we have developed hypertension, if we develop diabetes, we need to take those medications, and we need to correct the deficiencies like B12 deficiency, vitamin D deficiency, which are very common during this phase. Then about HRT. HRT is very important in menopause, but it has a window. Like it works best if it is started before menopause or within 5 years of menopause. Otherwise, it doesn't have much action. So, if we see the absolute indications of HRT, then severe hot flushes, if it is interfering with your sleep, like if you're not able to sleep throughout the night, there are 3 or 4 hot attacks of hot flushes in the night, then that falls into HRT works very well in that. If you have severe menstrual disorders, then HRT works very well in that. If the joint pains and all those things, there is partial effect. It's not a complete effect. But these are the, and of course, for vaginal dryness and vaginal atrophy, the local estrogen application works wonderfully well. So, for the symptoms like frequency of micturition or burning or dyspareunia, dyspareunia is a painful intercourse. So, for these symptoms, local vaginal estrogen gel works very well, and that can be used. And of course, the mind body practices like mindset training. As I said, mindset training is acceptance of the symptoms. Okay, I'm going to get this. I'm not running away from it. This is going to happen, and this is happening because of this. So that is the mindset. કે અરે રે રે આ શું થઈ ગયું, મને તો બહુ કંટાળો
Mm.
આવે છે, મને તો આમ થાય છે. You keep on talking about it and you keep on grumbling, complaining, cribbing. It's not going to help. Accepting it gracefully and then finding solutions, that is what we are supposed to do. Of course, meditation and mindfulness, we know it works wonderfully well, because again, that helps us in channeling our entire focus on a positive note rather than going into the reverse direction. And then cultivating the emotional beings. The commonest emotional symptoms are anxiety, brain fog, forgetfulness, irritability, mood swings, difficulty in concentration, feeling low, inability to cope up with the daily activities. Everybody faces this at some part of their perimenopause. some of the symptoms are definitely going to come. And the best way to tackle emotional well-being is by these mindfulness based living, meditation, finding out creative outlets. So if there is brain fog, then go for Sudoku and puzzles and all those things, and try to keep your brain active, acquiring new skills. Like you start a new thing, like as Shailaja is doing, like she's channeling herself to this part, being a housewife, or then doing what you like, and you get that happiness when you help somebody
Right.
to overcome this. So that helps in so gratitude. Again, these days people are practicing a lot about talking a lot about gratitude. It helps a lot. Then counseling and therapy, that is what I do. That counseling is because you need to bring awareness about the symptoms and to make people understand what this is going on. Connecting with support networks, like such groups where you come across people who share their symptoms and everything. Spirituality and well-being, we know this works wonderfully well. Faith goes a very long way. We believe in Bhagavad Gita, where we say that you do the work and leave everything on God. So when we cultivate this feeling, it takes away the boj from our mind, and we put the boj on Bhagwan. And I did my work, I did my job, now you take care. So that helps, that is the best antidepressant that can work. Chanting, rituals, these things, they bring a sense of positivity within, and it helps in overcoming everything. Now coming to hypnotherapy, what I'm practicing. So, what is hypnotherapy and what is subconscious mind? See, hypnotherapy, if we talk about definition, then hypnotherapy is a altered state of mind, and it is totally different from hypnotism, the stage hypnotism that we have been understanding for so long. We have seen people doing stage shows where they do a mass hypnotism, and they make you do all weird things. So that is not hypnosis. Hypnosis is altered state of mind. Like, you see, there is a conscious mind and there is a subconscious mind, right? Antarman and bahya man, which we say. So it is like a glacier. The subconscious mind is 1/8 and the subconscious mind is 7/8. So all our emotions and our feelings over the years get accumulated in the subconscious mind, and it manifests through the conscious mind. So whatever we are doing, so you must have seen કે મને ગુસ્સો બહુ આવે છે, મારે ગુસ્સાને કંટ્રોલ કરવો છે, પણ હું મારાથી નથી થતું. સો મેની ટાઈમ્સ વી સે કે મને આળસ આવે છે, મારે નથી કરવું, પણ મને આળસ જતી જ નથી. સો ઇન ધ કોન્શિયસ માઇન્ડ યુ આર ટ્રાઇંગ હાર્ડ. But unless and until you change that program in the subconscious mind, you are not able to bring about the change. Even in menopause, we must be think કે મને ગુસ્સો આવી જાય છે, irritable થઈ જાઉં છું. I don't want to get irritated, but we are helpless. કે whenever there is a trigger, બચ્ચા કંઈક કરે કે husband કંઈક કરે કે કોઈ પણ ક્યાંક થાય, તો there is a blast. Even though we don't want to do it, it happens. This is where hypnotherapy works, that we change that program in the subconscious mind. So hypnotherapy proper is induction of hypnotic trance. But if we take it practically, you must have experienced if sometimes you are watching a interesting TV show, which you get completely engrossed in it. So if somebody passes by, you won't notice. Even if the door opens and closes, you won't notice. Or sometimes you are engrossed in reading a book. Sometimes you are engrossed in doing an activity which takes up your entire concentration. You become unaware of the surroundings. It happens. so many times. And then if there is a loud bang, you just get startled and you wake up. See, we are awake. We are not sleeping. We are awake,
Mm.
but we are in that altered state of mind. This is hypnotic trance.
Okay.
Hypnotic trance is not that. So there are so many myths surrounding hypnosis. Ki, the hypnotherapist takes control of your mind. That is the very common thing. They make you confess the things which you don't want to tell. Or they sometimes, we must have seen in some shows or some serials or some movies, ki, they hypnotize and make you commit a crime. So all these things which are talked about hypnosis is totally false. This is not true. Hypnotism is not hypnosis. See, there are these two terminologies need to be understood very clearly. The stage hypnotism is not the hypnotherapy which we are talking about. In hypnotherapy, what do? We help in calming your body first by doing PMR, that is progressive muscular relaxation, and then we induce the trance. So many people feel कि strong-minded people cannot be hypnotized, but on the contrary, strong-minded people are the best persons who get hypnotized. Even people say कि it is for like uneducated or ignorant people. No, in fact, educated and people with high IQ get hypnotized more easily. So,
Mm.
hypnosis is only about altered state of mind, reprogramming of the subconscious mind, and that is why it works beautifully in anxiety. Because, see, anxiety, we know that we are getting anxiety attacks, we are getting panic attacks, even phobias. We know that this phobia is wrong. Like, see, if I'm scared of something, I know that this is not true. કે સપોઝિંગ અંધારાનો ડર નાના બાળકને લાગતો હોય કે
Mm.
weird things, like અત્યારે we seeing so many plane crashes. Air phobia is becoming very common, or claustrophobia, like you can't go in a lift or something. We know that this is not normal. We ourselves know, but then we are not able to overcome it because that is a faulty program in our subconscious mind. So that can be corrected by hypnotherapy. Overthinking is again a disease of the 21st century. As soon as we get some time, we go into this overthinking mode કે હવે શું થશે, હવે આમ થઈ ગયું છે, હવે કેમ થશે, and we keep on traveling. We travel thousands of kilometers in a few seconds, and then when we come back we realize, oh બાપરે, ક્યાંથી ક્યાં પહોંચી ગયા. So that is
Yes.
again a disease of, I call it a disease of 21st century. Then aches and pains, mood disorders, irritability, disorders, in all these things. Because basically in all, see, in physical symptoms, what happens, like as Shailaja was asking me, does it work in hypothyroidism or symptoms like those? See, directly it doesn't work in symptoms where the physical body is affected, like aches and pains. But how it works is, see, if I'm getting a backache, right, I go to a orthopedician, I get myself investigated, and I realize that, okay, there is no problem in my spine, there is no problem in my joints, my bones are okay, everything is okay, and yet I'm getting pain. So this pain is rooted in the psychosomatic cause. It is not a
Ah.
physical cause. It is very common nowadays. It has been well investigated and well established that if you have stress, chronic stress, it leads to backache because of muscle
Yes.
stiffness. Right. So that is well established scientifically now. It is not no more story
Okay.
thing.
Good to know. Good to know.
Yeah. So that is how, that is where yoga and meditation work also, because you are relaxing your body, you are relaxing of your muscles, and you strengthen your muscles, and the aches and pain go away. So hypnotherapy helps you in strengthening your mind, that I need to tackle my aches and pains in this way. They are not going to treat your joint pains, but it is going to make you strong enough to face the thing
Yes.
and change
Yeah.
it. So this is how hypnotherapy works. Even in sleep disorders, it is the same thing. If sleep is disturbed purely because of estrogen deficiency, then HRT does help partially in overcoming the sleep disorders, but it is not 100% cure with that. So again, for sleep disorders, if we are going in the overthinking mode, or if we are having certain disturbances or those things, then hypnotherapy helps in those. But it is more helpful in these anxiety, phobia, overthinking, irritability, and those symptoms. So it is a reprogramming of the subconscious mind. That is what is hypnotherapy. And it works best in stress management, decision making symptoms, then learning, like if I want to start a new regime. In all those things, it helps in strengthening, it helps in de-addiction, maybe from vices, or from some nowadays from gadgets also. So it helps in building our confidence. It is a
Mhm.
very important thing, because menopause plays a havoc on your confidence. You suddenly start
Mm.
feeling કે હવે મારામાં કઈ છે જ નહીં, મારાથી નથી
Mm.
થતું, હું નહીં કરી શકું. So those
Yeah.
things, they can be tackled very well with hypnotherapy. And then in our day-to-day things like communication,
Mm.
anger management, all these things, they can be tackled very well with hypnotherapy. So that is the thing. And about menopausal health considerations like bone health, cardiovascular health, cognition, and brain health, these all are affected in menopause. And so a regular health checkup, and if there is any problem, they have to be corrected medically and physically by exercise, diet, and a positive attitude. The wisdom of traditional health healing like Ayurveda, homeopathy, it has to be an amalgamation of everything, because the we know that Vat, Pitta, and Kapha, they get
Mm.
altered during menopause. So if we have to identify our Prakriti, like if I'm Vat Prakriti, I'm going to get lot of gas and belching. If I am Kapha Prakriti, or if I'm a Pitta Prakriti, I will get lot of nausea, vomiting, acidity, and all those things during perimenopause. They will be exaggerated. So if we know our Prakriti, we can alter our diet and our exercise pattern and everything, and they can be corrected that way. So as I said, perimenopause, over and above symptom awareness, it is about discovering our passions, it is about discovering our true self. And we need to pass on the legacy in a positive way. When I used to deliver, do obstetric work, as soon as the labor gets over and the woman delivers, most of the times they used to say કે અરે રે, આપણે બૈરા થયા, આ બધું સહન કરવાનું, આપણે આમ કરવાનું. And I used to always scold these women ki, why are you cursing? See, we are such powerful beings કે બાળક દોડીને આપણી પાસે આવે છે, એના ડેડી પાસે પહેલા નથી જતું. we
હા.
we have the power to control the family, we have the power to control so many things, and that is because of our hormones. So don't curse yourself as a woman. Be proud that you are a woman, you have so much
Yeah.
power, and you can do so many things with that power. So it is perimenopause is about celebrating the journey so far and continuing the transformation. So we pick up the things which are going to help us become more powerful, more beautiful, more energetic, and more useful to the society for the rest of our life. So that is the basic goal of tackling covering menopause. So I
Right.
think that
Yeah,
is
very nice, Hitesha.
enough.
That was a very myth buster and બહુ જ પેલા હિપ્નોથેરાપી વિશે મને તો કંઈ જ નોલેજ નહોતું. આઈ એમ શ્યોર જે બી જોડાઈ રહ્યા છે એમને બી કશું બી નોલેજ નહીં હોય કે રિયલી હાઉ હિપ્નોથેરાપી ઇઝ વર્કિંગ એન્ડ આ પેરીમેનોપોઝલ કોઈ સિમ્ટમ્સમાં હાઉ ઇઝ ઇટ ગોઈંગ ટુ હેલ્પ મી with all these things. This was very clear. And we now have a little trust. I won't say little. Now we know we have to do something about all these things, and we have this treatment option. This is a wonderful treatment option, I would say. So, everybody right now online or whoever is listening, and this will be also posted on YouTube as well. This was a really eye opener for me because I am listening this for the first time, and I'm sure people here all over, probably whoever is going to listen to this is for them it's the first time listening to all these information that was given by you. And this is I'm emphasizing this on a gynecologist, which is a hypnotherapist as well. So, just little brief, if we can know, how was your journey? How did you trust as a gynecologist? How you put trust on this kind of therapy? Did it help you, or have you experimented on yourself? How did you think about being a gynecologist and being as a hypnotherapist now? So, if you can brief us on that little bit.
Yeah. So, of course, it began with my perimenopause only.
Ah,
I started facing the symptoms in my late 30s. So, even though I was a gynecologist, this is way back in 2004-5. So, I was very young then, and uh, I was busy with my practice. With my son was young, you have your in-laws and everything. You are jumbled up in, and then suddenly you start getting brain fog. I lost my way while going. I didn't know where I was going, and for whole 10 minutes I was driving my car. I didn't know where, and then suddenly I realized, कि, oh, क्या अभी गई हूँ? I don't know. So it was that type of thing. I was not, but then I was not able to understand that is because of menopause. And frankly speaking, our textbooks never taught us menopause. We only knew that period stops, that's all. All this awareness about menopause has been recent over the past 10 years. Back then, even though I was a gynecologist, I was not aware that these symptoms are because of perimenopause. So
right,
I
right.
had a lot of symptoms. Over a period of 1 year, I lost almost 8 kgs weight. There was severe anxiety. I used to get severe panic attacks. Like I'll be sitting in between people, I'll be talking
Ah,
with people, and I'll suddenly start perspiring and have a severe panic attack, cold extremities, and I'll feel that I'm having a heart attack. So all this
ah,
was happening, and I didn't know what to do. All the investigations were coming out normal. I was taking antacids, I was
yes.
taking anxiolytics, but then nothing was helping. And then after 3-4 years of this all this drama, period stopped, and then I realized, oh, can this be because of menopause? That is when I realized. And we have a yoga institution here, which is called Yog Niketan. So I joined that. I think yoga is going to help me, nothing else. I joined gym also, but that also didn't help. Then I
Mhm.
joined yoga classes. Then I did my teacher training course.
Ah, okay.
uh, so it is a 6-month course. I did that. And there, in theory, this teacher, my teacher, who is my hypnotherapy teacher, he is a professor of physiology. So in our medical college, he was a professor of physiology in medical college, and he has started hypnotherapy practice since 80s.
Okay.
And so
Wow.
hypnotherapy in Gujarat and hypnotherapy in India is there since late 70s. So it
Oh,
is
okay.
not a new thing. Yeah, he used to, I did my MBBS in 80, I started in 85, and he was my professor of physiology. At that time, he was just beginning his hypnotherapy. He used to call us students and practice on us and all those things.
Ah,
So
okay.
now in this Yog Niketan, when he made us understood how hypnotherapy, how reprogramming of subconscious mind. So I did his workshop
Mm-hmm.
at his place, and that is how I was introduced to this, and it worked wonders for me. It
Wow.
helped me overcome all my problems which I was facing at that time, and so I knew that this is how it can be held. But as I said, I could not amalgamate it with my regular practice. But I had decided that once I stop my practice, I'm going to take this up as a full-time thing. And luckily
Okay.
now there is a lot of awareness about menopause. People are talking, people are realizing that, okay, menopause, perimenopause needs help.
Right.
So that, because
That's very good.
in the beginning, like even if you go and tell women, they were not ready to accept કે એ લોકોને
Yes.
હેલ્પની જરૂર છે.
હા હા
એવું
એક્ઝેક્ટલી
હતું
હજી
કે હા
બી
તો
વાત
થાય,
કરું
વાંધો
હા
નહીં. હા,
હજી બી વાત કરું તો એ જ કે ના આ તો નોર્મલ છે
yeah,
દેટ્સ ઓકે અમને કહેવામાં આવ્યું છે કે આ તો નોર્મલ છે થોડીક વારમાં થઈ જશે બટ ધેન અગેન
exactly,
ધ નેક્સ્ટ સ્ટેટમેન્ટ દે સે કે ક્યાં સુધી ચાલશે હવે આઈ નો
exactly.
that's why I'm saying कि there are so many treatment options one or other should work जैसे मेरे लिए योगा और मेडिटेशन वगैरह प्राणायाम वगैरह काम हो गया
हाँ.
मेरे से जैसे
Hmm.
if you have started hypnotherapy this therapy
Yeah,
helped him so we have to try and see which works for our body and our
yeah,
mental our physical state and see how it works
yeah.
from there so
See, meditation again is a type of hypnotherapy only.
right
Because in meditation, you are channeling your thoughts. You
yes
are with your
yes
subconscious mind only. You are
right
going beyond your superficial thinking. You
right
are overcoming the superficial thoughts
mm-hmm.
and you are going
Yes.
within. So
Yes,
that is a type of,
but the hypnotherapy would help here because not many would stop thinking. Like as soon as you
yeah,
close your eyes, thinking comes and lot of
गाड़ी
thinking
उपड़े.
comes. Ah, so it's better to do something about it. कि गाड़ी उपड़ी जाए एक बार. तो
Yeah, yeah,
hypnotherapy would help you to calm down a little bit, and then you don't need therapy all the time. Then you know કે ગાડી કેવી
yeah.
રીતે start કરવી, ને કેવી રીતે
And
ઉપાડવી.
we teach self hypnosis also. Like
Right. Okay.
I can work on myself also. It's not that I always need another person. So
Oh, that's a good
once you
thing.
practice it, you are able to go within and change your program. It
Oh, okay,
becomes
okay. That's good to
easier.
know as well. That's
Yeah,
good. If somebody is interested in doing that, that would be also a good thing
yeah,
to learn from you or anybody who is
yeah,
willing to help this way. So,
yeah.
good thing to start. And I think many questions are already coming. And let me see if my questions have been covered. So yes, I see that we have covered a lot of them from you. And let's open the chat. I will just unmute everybody and let's see who wants to question first. Okay. So I don't know if you can let me know about there is one question about how we can take HRT. I don't know if you want to answer this question. How we
HRT,
can?
yeah, so yeah, HRT is we get estrogen and progesterone because although there is a deficiency of both the hormones, depending on the symptoms, we need to do a basic primary workup, the investigations, and then depending on the symptoms, ideally HRT needs to be started in the perimenopausal phase or as I said, within 5 years of menopause. And now there are multiple options available. You can take it orally in the form of tablets. There are the estrogen patches are available, which are slow releasing patches. There are nasal sprays, which are they are not available in India, but they are
Mm-hmm.
available in US and probably Canada. I'm not sure about it.
Mm-hmm.
But
Okay.
yeah, so these are the various modalities of taking estrogen and progesterone. And Yeah, it works well. So
Okay.
for irregular menstruation and all those things, it definitely works well.
Okay. So that means, are there any tests that we are supposed to do, or just go to the doctor? Or I would suggest to go to a special, like a menopause coach or a consultant, I guess.
Yeah,
That
it is
would be a
better
my
to go to a menopause specialist who is prescribing HRT regularly. So
right.
it is you
Okay.
should, yeah, and they will suggest the investigations and all those. There is a protocol of starting HRT. So once you consult, depending on your symptoms, they will prescribe the
Okay.
medications.
Okay, that's good to know. Is there any other questions related HRT? You can type or let me know. So the same person is asking how we can do hypnotherapy. So is it done, do we do online, or how do we have to be in person, or what's the way
Yeah, we
to?
can do it online. I'm doing it online. Basically, it is therapy works for continues for about 5 to 6 sessions, and
Okay.
each session may be around 40 to 45 minutes. So that is how, because initially we start with breath awareness, then we go for muscular relaxation, and then we go for trance induction. So it is a stepwise process. It's not that directly we can induce hypnotherapy. You need to prepare yourself. So that is why it is session wise. And usually in 6 sessions, 6 to 7 sessions, you
Okay.
can uh, get the work done, whatever.
Work done. Okay, so
Yeah.
the same person. So now, who is asking for HRT and hypnotherapy? I think
After
you have
hyste-
got your answer. Is there? Okay.
After
Uh,
hysterectomy is only
yeah.
estrogen. Yeah, after hysterectomy, yeah, because progesterone is taken for the to prevention of endometrial cancer. So usually, yes, for after hysterectomy, they give only estrogen.
So is hypnotherapy going to help her in some way? Because this lady, she's going to says about anxiety, lot of anxiety issue, and there are other people online too, they have been having same anxiety issue, is the main culprit here, which is
Yeah.
bothering them. So
Mm.
is anxiety issue okay to be treated or by hypnotherapy?
Yeah, if it is, if it is severe anxiety, like as I said, panic attacks or something, then you need to take medication for some time. And we can do hypnotherapy simultaneously, and then we can switch over, we can stop medications.
Okay, but the
But
regular anxiety
yeah,
thing,
anxiety,
it
it
can be
works
done.
very well. Yeah, it works very well. It
It works
does work.
very well. So, yes, I would suggest those who have asked me the question about anxiety, I would tell them to encourage them to do this therapy and start doing it. Maybe that's if it has been taken care of, there are a lot of other things will be taken care of, like
Yeah.
anxiety. If it is anxiety, then maybe sleep issues can be taken care
Yeah.
of afterwards and stuff like that. So, I think that was the main question. If we can you guide us more on this anxiety? I'm sure there are a lot of women a lot. So fearfulness is the same thing. She gets fearful
Yeah.
very often. It has some episodes, and it's kind of anxiety. Do you think so?
Yeah, anxiety and phobia, it's a mixture of, I think. Yeah, but it happens. It gets exaggerated during perimenopause. Okay,
Okay.
nani nani vastu ma, you get scared, and then you exaggerate it, and that leads to stress. It triggers a negative chain reaction.
Okay. Has thyroid issues, or maybe taking steroids now, and there are a lot of weight gain due to that issue. So how these thyroid and can be taken care of? Or there are any lifestyle, or can it be done with hypnotherapy?
See, if hypothyroidism is happening, see, if it is because of lifestyle issues, then hypothyroidism can be corrected by correcting the lifestyle, so lifestyle modification. And most of the times these days, because as I said, see, thyroid hormone, the thyroid releasing hormone, then the gonadotropin releasing hormone like FSH and LH, which are the basic female hormones, growth hormone, all these have a common center in the pituitary gland in the brain.
Ah, okay.
And when one hormone is in imbalance, the other hormone also goes into imbalance. So, but again, stress has plays a very important role in triggering all these changes. So,
Okay.
if stress is the cause, that can be corrected by hypnotherapy. But of course, hypothyroidism has to be corrected medically. You have
Ah,
to
okay.
you have to take medicine. If you do it properly, and along with lifestyle changes,
Mm,
because
okay.
only popping a thyroid pill is not going to help in reducing the weight that we have gained because of hypothyroidism.
Okay.
So lifestyle changes are equally important. Medication is equally important, and if stress is an associated factor, then hypnotherapy works there.
Okay, okay, that's a very good answer, and I'm sure everybody is covered now, or everybody who was online and who have sent me all the questions, they are all covered. And I'm sure it's not just, I see that it's not just for menopause or perimenopause, it's for overall health nowadays because of
Yeah,
stress, depression, anxiety.
yeah.
I think hypnotherapy should be way to go, and this is a really a good way to go, and one should try this and see if it's going to help you on your symptoms, or it can be your treatment option, or forever you can learn hypnotherapy from the right person and then heal yourself from there. So
Yeah.
on the ending note, this is from me. If you want to how people can connect with you, and how can they get in touch with you, if you can just give us a closing note, that would be a wrap
Eh,
of the session.
Yeah, sure. I can be contacted on my WhatsApp number. It is there
Okay.
in I'm a part of your groups, so you
Yes,
can contact
it's okay
me.
to contact.
And
Yes.
yeah, and you can send me a message on my WhatsApp number, and we can go ahead from there, and we
Okay.
can just fix up a consultation online first. And so that is to just understand what's going on and what you want to do. And then we can decide on the therapy part later on.
Okay, okay. So, I would suggest whoever wants to do a previous consulting first, they can connect with Dr. Hitesha. We have she is on our WhatsApp group. She can you anybody can contact and go from there. So, thank you so much, and very eye-opening. And I'm sure a lot of women will get help from this, and we'll be in touch if there are many questions, or other things comes up, or some session we want to do on mindfulness or self hypnosis and stuff like that. We can conduct a workshop. It can be a paid workshop. Obviously, we don't want to do everything for free, but at least we can have a general introduction, and so that people get encouraged, so that we can go ahead and learn something about this therapy. And
Definitely.
thank you so much for coming.
Yeah.
It was very generous. Not everybody gives us time like this, and I'm really thankful that we have somebody like you in our panel, and expert. And just cannot, I don't have words to say thank you, but we'll definitely be in touch, and we'll take your expert opinion in our future as well.
Thank you. Thank you
Okay,
so
okay.
much. Thank you so
Thank
much.
you.
And
Bye bye. Good night, and
have a good
everybody.
day.
Yeah.
Bye. Bye bye.
Bye.